All right, for those that are joining, we're going to give everybody about 2 more minutes. We've got quite a large group that's supposed to be attending today, so we want to make sure everybody gets in before we get started. All right, so I think we'll go ahead and get started today. We've got a decent number of attendees, and I know there's going to be more probably rolling in here in the next few minutes, but we'll get started. We've got a lot of material to cover today. I'd like to thank everybody for joining us today. We're going to go over some HITRUST, baseline information. What is HITRUST? Who is HITRUST? We're going to talk about the new version 11 in some detail with the impacts that it may have on your organization. We will talk about the benefits of adopting the HITRUST framework into your organization and what that would mean for your go-to-market strategy for implementing with your U.S. market. So again, today's webinar will be focused more from an India base for organizations in India that are working with U.S. healthcare and U.S. organizations. So we want to make sure that everybody understands that focus is there. We also will be taking questions at the end, but please use the question and answer module to post any questions. We'll review those during the session. If there's anything that should be addressed before we get to the Q&A session, we'll bring those up during the conversations. Joining me today for our discussion is Andrea Britt. Andrea is our Senior Director and Principal Consultant for the HITRUST practice here at Accorian. Also joining us representing HITRUST is Eric Rozier, who is the Director of Client Development at HITRUST. So I want to thank them for taking time out of their day and joining us. So what we're going to do, we'll move forward with today. I'll take a couple of minutes talking about Accorian so we can cover who we are, what we do, before we jump into the specifics around HITRUST. So for those who aren't familiar with Accorian, we're an established cybersecurity advisory firm that serves a global clientele. We're helping businesses of all sizes improve their security posture through compliance readiness, audit, penetration testing services, as well as meeting both and long-term staffing requirements. One of the key things with Accorian, we're one of 9 organizations in the world that cover every compliance standard out there. So we work with organizations to develop, a strong information security management program. We want to make sure that not only are we working with the organization for compliance framework certification needs, but also building a strong security stance that stretches over a myriad of industries, everything from fintech to health, e-commerce, media, you name it. We can work with organizations on building a strong security presence within their organizations. Also work with them on helping build out strong security requirements for vendors and anyone that you transmit data with. As I stated earlier, we do work with just about every security compliance framework out there. So all the great acronyms are covered. We do specialize as a high trust assessor. That covers about 65–70% of the core business of Accorian. But we are a SOC 2 shop, as well as we have our own SOC 2 attestation organization, Accorian Assurance, and we do work with ISOs and GDPR, you name it, there as well. Some of the other services that we do offer to organizations, because we try to keep everything as in-house as we possibly can to streamline the process. So we will work with you from a pen testing perspective. We'll take care of all your internal, external network testing. We do PCI IST. We're also a QSA as well. So we'll handle pretty much everything from the credit card side of the house. All your vulnerability testing, red and blue teaming, will help you build your BCDR, IR plans and exercise them as well. And then of late, within the past year or so, we've rolled out our vCISO program, where we're really looking to build and help you manage that overall information security management program. So we will come in and provide you that fractional, CISO service to supplement your security staff, or actually function as your security staff, to help you bolster whatever needs you need to cover there for your security program. So we'll do everything that we possibly can there to helping you roll out your program, help build and manage your policies and procedures, look at your tools, look at what you've implemented, perform risk assessments, posture assessments, work with you and your vendors to make sure that we have everything in place that needs to be there as well. So with all that being said, that's Accorian. We are a global organization. So, I do want to make sure that, we understand we have offices in Bangalore and Pune, as well as here in the States. And as I mentioned earlier, that for those who caught the conversation when we first got started, we have recently opened up a Canadian office in Vancouver. We are looking at another office in Toronto. And then as well as some other areas throughout the globe to help support our clients. Moving forward now, we want to jump into the topics of today. Basically, again, we're going to talk about what is HITRUST to start with, and what it means to implement the HITRUST framework into your organization. So I want to kick things off today by bringing in Eric. Again, Eric's the director of client development at HITRUST, and he's going to walk us through, kind of the high levels of what is HITRUST for those who don't know, and then some of the key points for implementing it into your organization. So, Eric, welcome, and thanks for joining us today.
Great, Sean. Thank you for inviting me, and really happy to be here. So, Andrea, if you want to advance to the next slide. What I wanted to do is start not specifically into HITRUST immediately, but let's talk about the context for why HITRUST. And I think there are some very solid facts where organizations have historically looked at IT security as a have to do. It's a cost, it's an expense, and so the first point on here is the justification, because it is an investment. And when you look at some of the benefits you'll get, and we'll get to some of that further down the discussion, but immediately everyone's aware of kind of the most recent incidents in the market, the cyber incidents with MOVEit, for example, and organizations' lack of ability to respond to those incidents, or even understand the scope and the magnitude of are they impacted or not. So with HITRUST, there is a justification for an investment. Almost half of breached organizations suffer damage to their brand and brand value. Some of the latest information, as we've done additional surveys, this could be costing organizations up to $10 million of impact from revenue and lost customers, not to mention fines and other components that liabilities that come along with that. With HITRUST, we've seen very high adoption with the largest customers, and not just with healthcare companies, which is our history is rooted in healthcare, as you know, but we've expanded the framework and our assessments to be inclusive of not only healthcare, but other. So we've seen 75% of the Fortune 20 organizations in the US adopt the HITRUST CSF. And of course, there's varying scale across how much they use it and how much they don't. The other kind of big piece that organizations miss is that as a vendor to an organization that's requiring assurances upon you, there's a significant amount of costs that you incur in staffing and response and cycle times, just answering questionnaires. And most of the time, these are questionnaires that are not necessarily tied to a particular framework. They are self-attestations, so the quality and reliability and comfort that they actually provide to an organization is very low. But the problem has been there's been no standard. HITRUST is becoming the standard now. So if once you're HITRUST certified or HITRUST validated, you have the ability to take that validation and share that with other organizations or other customers that should move you further up in the line of opportunity with these customers or prospects. And it will also, they'll accept those in lieu of you filling out other questionnaires that are redundant and far less reliable than a HITRUST certification. The other thing in the lower right box here, I wanted to make very clear that 80% of the top cloud service providers use HITRUST. And in terms of in the third box in the center row, why is the cloud provider certifications important? Because on average, 70 to 80% of the controls, if your product or services are in a cloud, you can inherit directly from the cloud service provider without having to do additional testing or policies and controls around those that are owned or shared with the cloud service provider. So that's another piece. As HITRUST has released version 11 of the framework, which I'll talk about. It gives organizations much more ability to leverage work that's already been done and rely on the work of the cloud service providers. So kind of, the last bullet point is in that lower line there, the third box over. As we all know, there's been significant increase in ransomware and phishing and such over the last 12 months. And so everyone's highly in tune to that. And that's one of the things I want you to think about as we talk about what HITRUST has done with the framework, the CSF, in terms of making it cyber threat adaptive. Okay. Andrea, can you go to the next slide? So as I talked about on the first slide, organizations are facing kind of a new but universal challenge. Their access to capital, funding, and new customers is becoming very much a question of, does the customer have confidence in your ability to protect their data? Stakeholders from the customers, they want assurances to reduce the risk as much as possible. And we all know that you can't be perfect in reducing inherent risk, but HITRUST gives you the opportunity now to make a significant step in doing that at a reasonable cost and effort. So I want to say that again, a reasonable cost and effort. In the past, HITRUST offered one assessment. It was, and we still have it, it's a risk-based assessment, but it wasn't appropriate for all levels of inherent risk. We now have two options that are, which we'll talk about, which are much more in the wheelhouse of organizations of different sizes that handle different amounts and types of data. So as we all know, it's an enormous and complex problem and challenge for all organizations to achieve these assurances. So Andrea? So how HITRUST can help, okay? HITRUST, when you think of it, I think of it in two buckets. There is the framework, the HITRUST CSF. We'll talk more about that in a second. Then there is a assurance program or a certifying body that is independent that organizations can scope an assessment against this framework that has, as you see, nearly 40 different standards in it. They can do assessments against that framework. And we look at policy, procedure, implemented, measured, and managed of each control. So not only is it just, it's not a binary, it's a Prisma methodology we use, and I know Andrea and Sean will get into more detail on that. but it enables organizations to customize, or we use the word tailor, to the appropriate level of risk using the HITRUST CSF. So, and when you incorporate all of this together, we call it the HITRUST approach. So you go to the next slide, Andrew. So as we talk about the HITRUST CSF, so if I go back, and Sean and Andrew, you'll know that Common Security Framework was what originally the name was. It was, HITRUST was formed in 2007. So we've been around about 16 years now and have continued to evolve. I mentioned that there are 40 authoritative sources. We have standards that apply from financial services to healthcare to travel and leisure. So we are now more industry agnostic. For example, we have FFIEC mapped into the framework now. So if you're a financial services organization, certainly that's appropriate for you guys to be able to look and scope and assess against that authoritative source. It is designed by security professionals for security professionals. So it is a much higher level of in-depth of control, reference, and implementation, and understanding. And when we get into what's changed with version 11, I'll be able to show you some of those specifics. So it's not a binary type answer. It's not a question that's been tried to be translated into simple words that really provide much less comfort and lower level of assurance. So the other thing is, as you know, many authoritative sources may only get updated every 4 or 5 years. HITRUST updates this 2 to 3 times, and maybe sometimes 4 times a year, depending on what's happening in the regulatory market. Right now, we know there's been a lot of action around state ramp. And so we've been working diligently with each of the states and the organization that are pulling the states together so that we can integrate and adopt. And I think you'll start to see some of those requirements and reciprocity start to manifest itself here in Q4 and early Q1 of 2024. So next slide. So again, we've talked a little bit about this, but let me talk about the structure of the CSF, the HITRUST CSF. We basically have 14 what we call control categories. There are 49 control objectives and 156 control references. Well, what does that mean? For an organization, it means with our R2 assessment, as you go through your scoping questions, which are the critical first step, and that's where Sean and Andrea and their team really help add value to these organizations in terms of helping them, how do they design the assessment to get the appropriate coverage and the highest level of scoring against these so that they can provide confidence to their customers and prospects that they have a solid security program and are managing and maintaining a solid security program. I guess more impressive to me is there's over 2,200 requirement statements. So think of those as a question tied to an authoritative source. Maybe it's access control, or it's password management, or mobile devices. Not every assessment, as a matter of fact, I've never seen an assessment with all 2,200 requirements in it. That would be a monumental lift. So again, it comes back, what we see is for an R2 assessment, we see around 350, maybe 400 requirement statements. And then on our 2 new certifications, they have a fixed level of requirement statements. So for certifications, it's important to remember that you go through and assess yourself with your assessor. Then the assessor does a validation. Then our assurance team, we call it our assurance team or our QA team, is the next level of review that enables not only just a third-party validation, but also our standards body to attest that you have achieved a certain level of scoring and that you are HITRUST certified. It's broken down into, you'll hear the word a lot moving forward, around 19 domains. And there is a threshold that you need to achieve on each domain to achieve certification. And it's based on being properly scoped. Okay. Andrea, can you take this? So if we look prior to January of this year, we've had a framework. We were on version the version 9 parts of the releases. We took a full leap in January to make the framework more cyber threat adaptive. So there were controls and authoritative sources that we had not yet mapped in over the version 9s that needed to be mapped in given where the threat intelligence is taking us right now. So it's enabled us to deliver 2 new assessments, what we call an E1 and an I1, that it addresses organizations with more moderate or lower level inherent risk. It's more doable, it's faster, and also works like the other assessments or like the other R2 assessment, but is much more flexible. The other key pieces of this is, it aligns now the portfolio to the assessments. Also, and we'll talk more about this later, but it enables a traversable journey, meaning that if you do an E1, which is our entry level, then all the controls there are also covered in the I1. All the I1 controls are also covered in the E1. So if you do those within the 1-year cycle, you can actually rely on those reports as you traverse up the portfolio to an R2 certification. Overall, with V11, the way we've restructured it and updated it, it also reduces the overall level of effort when it comes to an R2 assessment. And we've also expanded the authoritative sources, and I think there'll be a couple of bullet points on that here in a few slides, okay? So I mentioned several times with version 11 that we have out now, and I think we're about to release 11.2, we have 3 assessment options. So on the lower right or lower left there, for organizations that are really have lower levels of risk, there's a lower level of assessment called the E1. It's 44 controls. It's only evaluated against implementation of the control. And it is foundational to, and what we call the essentials. So it is fundamental cybersecurity hygiene, we call it. So think of it as a surgeon who washes their hands for surgery, would be the R2. Someone who's just, you're washing your hands before you eat, that's more like an E1. It's foundational, it's important. And what we're finding is a really high adoption so far in the first 6 months of this E1, because it's covering and validating some of the fundamental things that somehow get missed in the questionnaires and surveys and other forms of assessments. Things as simple as multi-factor authentication, which are critical. So I talked about the traversability. The next step up is this implemented, what we call an implemented 1-year certification. So it comes with a certification just like the E1. It's only on the implemented controls, but it is the next step focused on leading security practices. So you can demonstrate control against 853 and NIST 800-171. A lot of the small business authoritative source pieces are in there, but it's 182 requirements. So it's a much more doable assessment from an investment of time and resources, but also produces a validated certification that you don't get with many of the other assessment instruments out there. And then, of course, the one I've talked probably most about, which is the risk-based 2-year validated assessment. And I say it's risk-based, which is why it's R2, because it is tailorable to the risk factors in your organization. And Sean, I can't remember how many risk factors, or Andrea, that we have when scoping an R2. Do you know off the top of your head?
I don't.
Okay.
No, I think it's got 26 plus, I think, is left at it. So
yeah. So it's tailorable to the risks, such as the number of records, facilities, where the facilities are. So it is the gold standard in cybersecurity and cyber risk and compliance. And organizations can work to that. But Sean and Andrea will certainly can provide more information on that as you have questions. So we can go to the next slide. So again, I've talked about this on on the in the previous slides, there are 3 certification options now. The E1 is a 1 year. You go through the 44 controls again in year 2. I1 is also a 1 year certification, and you go through what's called a rapid recertification. So you don't have to evaluate all 182 controls in there the second year. It's more of about a third of those, about 60 of those. And that's a combination of new authoritative sources that have come in based on threat intelligence, the retirement of some authoritative sources that may no longer be relevant, and then a random sample from your previous assessment. So I believe it's about 60 controls that an organization would expect to reassess in year 2 of an I1. The R2 is a 2-year certification. So in year 2, the in-between year, it's a random sample of controls that are pulled from your prior assessment, including looking at CAPS and NAs, and then just a random sample to make sure that the environment has not materially changed, and that you still have the controls in place and tested to prove compliance and assurance. Okay, next question. Okay, let's talk about version 11 of the framework. Go ahead to the next slide. So if you have downloaded the CSF, and if you haven't, I encourage you to go to HITRUSTalliance.net and you can download the framework. One of probably the biggest improvement, and I think Sean and Andrea would shake their head to this, is that on the lower left, what you see here is what we call a requirement statement, okay? And below it there under the illustrative procedures, this is how it used to look, where the illustrative procedure was in a separate click down, and it was just a stream of text that basically instructed you how you're supposed to test, the sample sizes, to score the implementation or policy or procedure of the control. It was very confusing and hard to track. So we simply restructured it in version 11 and broke out what we call the evaluative elements now that enable an organization to look more simply at, okay, identification of codes used in conjunction with passwords for electronic signatures are protected by 1, maintaining uniqueness of each combination of the identification code. It's broken down numerically there. So for both the assessed entity like yourself and the assessor firm trying to interpret this, it helps clarify the prescriptive nature and the requirements around testing that need to be done to score the control Prisma score. Okay, so that's a big change to make the HITRUST easier to use. Okay, next slide. So as we talk about with the release of version 11, we also have to sunset prior versions. And as we thought through this, versions 9.1 and 9.4, if you think about version 9 was released, gosh, I believe in early 2017. So it's been out there for a while. But we wanted to enable, and we have the majority of the assessments that are live right now are on 9.3, 9.4. So not to squeeze anyone in terms of time, there'll be an end of life for organizations, and this is actually approaching pretty fast, but any assessment, if you want to assess against 9.1 or 9 through 9.4, you have to create that assessment object prior to September 30th. Now, we're seeing majority of the organizations that are starting their journey are starting with 11, just because it's simpler and it's much more thorough. And then you would have until December of 2024 to actually submit that for validation. And then we'll continue to keep the libraries out there for reference, because you always have to go back and double check and things. So the reference libraries will stay out there until probably end of first quarter of 2026, so that you'll have that as a resource for some period of time in the future. Okay, next slide. Okay, so that's the information on HITRUST. I talked a lot about the scoring, how you score the controls to achieve certification, the weighting of those scores. And I believe that, Andrea, that you're going to walk us through that more technical conversation.
I am.
Thank you.
Thank you very much, Eric. All right. So Eric talked a little bit about those maturity levels. There are, in an R2 assessment, the full assessment that he mentioned earlier, there are 5 maturity levels. You can see on the right side of this slide: policy, procedure, and implementation, and then also measured and managed. So with the breakdown of the scoring weights here, you can see how each of those maturity levels are weighted when it comes to the overall score of a particular control. With the E1 and the I1 assessments, as Eric mentioned, it kind of streamlines the process of validation testing, because the only thing that is scored is the implementation. So both I1 and E1 assessments are implementation focused. So that means that we are only going to score implementation. However, the evaluative elements that Eric mentioned in version 11, for some of those E1 and I1 controls, they include the need for an organization to have documented policies and procedures. So although we won't be scoring them as we would under an R2 assessment for strength and coverage of the documentation, they're important, and HITRUST acknowledges this, including those as an implemented piece of evidence for certain controls, because policies and procedures are foundational to building that robust security program that every organization needs, also mentioned by Eric before. So something to keep in mind if you're looking toward beginning your HITRUST journey and using the E1 or the I1 assessment, if your ultimate goal is to move eventually to that full R2 assessment, then you want to make sure in developing those policies and procedures that you're looking at those strength and coverage requirements that are in fact required for an R2, full implemented, full scoring assessment. It will save you, it'll make it an easier lift when you do move from that E1, I1 into the R2. And again, as I mentioned before, most importantly, your organization is going to have that documented foundation for that effective security program. So let's talk a little bit about the journey of HITRUST. So there are several things that an organization needs to determine when starting this HITRUST journey. Eric mentioned scope, which is incredibly important to clearly and properly identify the scope of a HITRUST assessment, regardless of E1, I1, or R2. So we say this all the time to all of our clients. The HITRUST does not certify the organization. They certify an implemented system or platform that is identified through that scope process. So there are a number of reasons why an organization may want to achieve certification on a particular implemented platform or system. One of the reasons could be that there's a contractual requirement. You've got a customer that says, we aren't going to do business with you unless the platform or the system that we're using through you has a HITRUST certification. So that's one reason why you may come to the HITRUST journey, to start your HITRUST journey. Another one could be a regulatory requirement. If you're subject to the HIPAA rules, if you're either a business associate or a covered entity under HIPAA, then there is a regulatory requirement that a risk analysis is performed on all of your systems that contain or use EPHI. Or another reason that you might want to start a HITRUST journey is to see how you measure up. You don't have anybody pressuring you from the outside to achieve this certification, but you really want to see how the systems in your organization measure up. Could be used as a good marketing tool in the future to bring customers in if you have that certification on a particular platform or system. So that's just a couple of the reasons that you may want to choose certain assessments, either an E1, I1, or an R2 to assess against. And it also helps you determine the scope. That contractual relationship, for instance, if you have 5 different platforms within your organization, but your customers only use 2 of those, then you may want to look at just scoping your HITRUST assessment based on those 2 platforms. So whichever assessment object you choose when you start your journey, there are certain project steps that we at Accorian will walk you through. So these are what you can expect if you use Accorian as an external assessor. So first we have a discovery process, which it's, as you can see here, client onboarding, gap assessment. It's really to determine your organization's current state. For example, would your existing policies and procedures meet every one of those evaluative elements that are required to be in documentation? If not, you're going to be assessed. It will be determined that you have a gap there. So the ultimate and the deliverable from that discovery process ends up being a gap report that it spells out where you may have some work to do or remediation efforts to put forth in order to meet the HITRUST requirement appropriately. So that remediation process is the next step. And this is where the organization, based on what's identified in the gap report, would then determine what makes sense to fix. With help from us, some advisory services that we offer during this time frame, you can figure out what needs to be fixed. If you've got some high dollar, some high ticket remediation that needs to occur, perhaps you need to do some evaluation on, number one, the type of assessment that you've selected, or does it make sense to put that as a possible future remediation if in fact you might still be able to pass the domain, one of those 19 domains that Eric talked about, and then remediate something in the future. That's all information that happens during remediation. Again, along with some advisory services from the from the Accorian discovery team to help you with that. When remediation is complete, you've identified everything that you wanted to fix. It's been fixed. It's been fully implemented into the system or the platform that is being assessed. Then HITRUST has a required incubation period. So it's for changes to how a process is conducted. That is a 90-day period. We call it steady state sometimes. But that is a timeline where the control, after changed, must be continuing to operate, successfully operating in that new revised state for a full 90 days. And there are a couple different things that need to happen there, or the reason behind that 90-day incubation is when your external assessor, Accorian, asks for evidence for that particular control where you had to make some changes to the way a particular control is conducted, we must always gather at least 90 days worth of evidence in order to appropriately test that control. So having that incubation period allows us to gather that 90 days worth of evidence. And that's the main reason why HITRUST wants that incubation period to have the control functioning properly for a full 90 days before it's tested. So after that incubation period, actually about halfway through that incubation, Accorian starts a validation preparation period and evidence collection. What validation prep is, it's where a different team at Accorian reunites with the team on the client side, and it's just to start prepping for the validation testing. So about 80% of the controls in a HITRUST R2 assessment are sampled controls where HITRUST requires that we select a sample from a total population and test that sample. So population files are starting to be prepared during that VA prep time period. And samples are selected from those population files, and then evidence collection for any control that hasn't been, where a change didn't go through remediation, we can start gathering evidence for that. And then after the full incubation period is passed, we would collect the evidence for anything that went through that remediation period. And then the validation assessment starts. So that's where Accorian validation testing team would take all of that evidence that's provided during that time period and test your policy, your procedure, and your implemented evidence against the control. As we talked about the scoring earlier, we score for an R2 assessment the policy, procedure, and implemented always. In some instances, we include the measured and managed maturity levels as well. But we base a score, we create a score based on the evidence that we have, and that is what ultimately is submitted to HITRUST. So I'm going to hand it back to Sean. He's going to go over some of the additional go-to-market strategies.
All right, thanks, Andrea. Thanks, Eric, too, because you know, a lot of times when we're going through these initial conversations with organizations that are considering HITRUST, the number one question that always comes up, and it's always that very first thing: do I really need HITRUST? Why HITRUST? A couple of things we like to bring up, is we'll talk about the go-to-market strategy and things like that in a second. But Eric's touched on this in the beginning. It's our scare tactics slide. It's that slide that has all the numbers, and if you don't do HITRUST, these are all the bad things in the world that are going on. That slide was actually created earlier this year. It's included in the HITRUST CEP decks and some of the other sales literature directly from HITRUST. But one of the questions we've had come up and recently is, well, aren't we seeing a dip in attacks in cybersecurity, especially where healthcare is concerned? And yes, cyber experts, up until probably about 6-8 weeks ago, we're saying, yeah, we've noted a slight dip in the ransomware attacks out there and some of the other things, but they cautioned everybody, saying, hey, this is only going to be temporary. We fully anticipate the full barrage of attacks to come back up. No sooner did that statement come out, and that statement actually came out from John Ridgey at the American Hospital Association. He's the advisor, national advisor for cyber security and risk for AHA. My fault. Anyway, literally, he said this statement, and we had 2 major attacks happen like the next day, specifically in cyber for healthcare. So we had the MCNA attack, and we had the Farm America attack, both of which were very unique in the way that their approach was, because they specifically went after treatment versus where they were going after before. They would go after the ability to shut down an organization's operational stance, where these 2 specific attacks were going after the ability for organizations to perform treatment activities. So it's a little scary when you look at it from that perspective now, where before it's like, okay, yeah, somebody clicked on the wrong email, and we've got this issue, and somebody loaded something in our system, and we got to go clean it up and all that kind of stuff. And then the historical ransomware, hey, we're just going to block you out, we're not going to let you go do stuff, to now they're actually putting people's lives on the line by going out and doing this stuff. So when we say that this is serious, it's not just a scare marketing tactic. It really is getting to the point where people's lives are on the line. Some updated numbers that I've been able to collect over the last couple of months, based off of some of the information we've been passing on these percentages. As of late June, there were more than 220 cyber attacks targeting hospitals and healthcare systems by themselves. And it impacted 36 million people. And if you think about that in comparison to last year, 2022 as a whole, there were only 44 million total people impacted by all of the healthcare attacks that were going on. So, we're looking at, clearly by the end of this year, more than doubling that, with the emphasis being on the fact that, it's much more severe than what I think we've anticipated or what we've seen in the past. So the lull that we've kind of gotten from the cybersecurity side of the house, those of us that are responsible for managing this, we have to now raise our awareness. We have to raise our attention to respond to these here, because a lot of our customers, your customers as well, that you guys are dealing with, directly work with patient care. So, it's something that, again, it's not that it's any more important than anything else going on out there in the cyber world, but, the emphasis of, the inability to deliver cancer treatments or, frequent treatments that patients need, becomes a life and death thing versus just the availability of records and data and operational space. Okay, so all that being said, the overall focus of this webinar was to, help you guys figure out, how do we implement, why do we implement HITRUST into our marketing process? Like I said, this is an Indian-based webinar, and the approach this year was for organizations like yourselves that are supporting U.S.-based organizations, in the healthcare market. But, not just saying that, hey, this is only around the healthcare side. This is really anything. If you guys are supporting any organization or you're even rolling it out yourselves, as Eric covered earlier, the HITRUST framework, really can be overlaid over top of a myriad of industries and processes. It doesn't just have to be healthcare. And we are seeing this quite a bit from the assessor side of the house, where we're seeing more fintech. We're seeing more manufacturers coming in and saying, hey, does HITRUST apply to this? I know it says, PHI and PII and all that. I was like, well, yeah, it does. We can easily apply the HITRUST standards to corporate confidential. We can easily apply it to your processes within your organization. So it will give you a much more enhanced level of awareness and security and a stronger security stance, regardless of your industry. So just keep that in mind as we walk through some of these GTM benefits that we're going to talk about here. But all in all, at the end of the day, HITRUST can indeed fuel your go-to-market strategy for your U.S. health market, and really, as I just said, any market. As Eric talked about, it's a widely recognized and respected security framework and certification program specifically designed for the healthcare industry. And that being said, we know that there's other organizations. The federal government itself is even looking at HITRUST as how they implement the framework into specific areas within the U.S. federal government. So it is, like I said, an overlay that we can easily put over top of any type of organizational security structure. Achieving the HITRUST certification really it's a badge of commitment to your vendors, to your clients out there, saying, hey, we get it. Security is a big deal. We're here to develop a strong program. We're going to maintain the high standards that are represented within the HITRUST framework to ensure as best as we possibly can the security of the data and the practices of the processes in which our applications and support systems are laid out there for. So when you're looking at rolling out your GTM strategy, really look at it from that perspective, from the marketing side of the house. What is the message that I'm giving out to those that need to see this? It's not just another logo to put on a website or a stamp to put on, a sales literature. There actually is a in-depth meaning behind this. So some of the key areas that we want to cover, for your go-to-market strategy, we'll talk here, about these key areas. Obviously, there's probably at least a dozen more that that we could talk and spend all day working on. But these are some of the ones that I feel that are very important for you to consider when you're looking at why HITRUST. What should you do about this? What's the value of doing HITRUST? Besides the fact that somebody said I had to. The first thing is, as we talked about, enhanced trust and credibility. Healthcare industry places a significant emphasis on the data security, and privacy. So, by attaining HITRUST certification, you're signaling to your potential customers, your partners, and your stakeholders that your organization takes data protection seriously. As I just talked about, this isn't just another badge. It helps you build trust and credibility, which is crucial factors when you're entering the competitive healthcare market. Again, we're still sitting here, and I think all of us on the HITRUST side of the fence, the assessor side of the fence, we always want, at some point, all the data providers, all these large healthcare providers to come back and say, hey, if you're going to touch our data, you have to be HITRUST certified. It's yet to happen. We keep threatening that it's going to happen, but really honestly, I believe at this point, and we tell everybody we talk to, it's not a nice to have anymore. It's an essential need. I think, and outside of or just short of, having, organizations say, you can't touch my stuff without having HITRUST certified. We have to go into this process with the understanding that, this is something I have to do. If I'm going to play with healthcare data, this is what I have to do. The competitive advantage, differentiating yourself from competitors, it's essential in your market. You want to do everything you possibly can to stand out. Obviously in the U.S. health market, that's no exception. There's what I think over 6+ billion registered companies just in the U.S. alone. 2.5 million of them touch or do something with healthcare data. So a third of the current established companies in the U.S. right now are direct competitors, with the global market. So we want to make sure that, whatever you're doing, you're differentiating yourself out there. And HITRUST is obviously a key component to being able to do that. Expand your market opportunities. Obviously, adding this here, you're looking at the ability to, whatever your focus is from your application, from your service and support products that you guys have out there, you could be looking at the ability to expand that model. Hospitals, insurance providers, government entities, we're looking for you to have the ability to say, hey, is this an open market, that HITRUST would help support me getting into? The big ones here, the last, two here, compliance with regulations. Obviously, HITRUST is going to, not only help you get there, but it's going to help you stay there. And it's one of the key things that, HITRUST is from the very beginning has been about being a maturity-based assessment, not just the stake in the sand, as we've seen with some of the other frameworks. It's good to know where you've been. Did you do all this stuff? Did you implement it? That's great and wonderful. And from HITRUST perspective, we'll check and see, did you do all that? The big question is, are you still doing it? What are you doing to improve it? So thus the reason the process is set up, for us to be able to do the checks and balances, look at where we are from a testing perspective, from a maturity base, and say, okay, yeah, you're doing this, but you should be doing this better, or hey, there's better things out there. Probably the biggest change in HITRUST in years has been the ability for them with the new assessments to become threat adaptive. So, we really want to take advantage of the fact that they are looking at the current threats that are out there and adjusting the framework accordingly. And then that's reflected in your periodic reviews that we go through. So we want to make sure that, inside of that we're maintaining compliance with whatever regulations that you need to be compliant with, whether it be, independent, state, federal, whatever it might be, or just a standard baseline. Hey, what are the minimum things I should be doing just to make sure, life doesn't, change drastically for us, to the negative. So we want to make sure that you guys are well prepared, for things that are coming up in the market. And I think the threat adaptive approach that HITRUST has adopted here in the past few years is definitely going to help you guys with that. The second, or the what I would consider one of the most important pieces of adding HITRUST to your go-to-market strategy is the risk mitigation, and that's really where, if you take a look at the control base, that when you go through either the E1, I1, or even the scoping, you're going to see a lot of those controls are based on your risk management program. They have to touch it at some level. It's not only is it there and do you have one, but what are you doing to exercise it? What are you doing to improve it? What are you doing to manage it? So, things like, data breaches and security instances, we all know they can have severe, consequences on your organization and on your customers. But, having a good, solid, rigorous security control and practices, process in place, which is, prescribed by HITRUST, it's going to reduce the threat of you having to, deal with a breach, or any potential, legal or repercussions, from your clients. So again, it's one good thing to have it. Risk assessments, third-party risk reviews are always great and wonderful, but they're only as good as the paper they're written on. What we want to look at is what standards are we applying your risk program towards. So we want to look at, where are we with, with that risk program, and by implementing all this together, in your go-to-market strategy. These are the touch points that you can sit there and put in your sales literature when you're talking to these U.S. health markets saying, hey, I'm HITRUST certified. This is what I'm getting out of it. This is the assurance that I'm going to provide you where, we are secure. We're managing our program. We're being proactive in our program. And unfortunately, when we talk about other certification frameworks like SOC and ISO and some of the others, they're reactive. It's okay, let me go test, see, are you following your processes and your procedures? Here's the standard. Did you do this? If not, then you got to go back and remediate and go do it. What we're looking for in a HITRUST perspective is going forward, what are you doing today? And then what do you have to do going forward? And then organizations like ourselves, like Accorian, we're capable of not only helping you get through the compliance certification process and getting you ready for it and going through the validation piece of it. We will have you work on your sustenance program. So, and I always say this, it's another one of the scare tactics, for getting people to buy into this, but, it's one thing to get certified. It's another thing to keep it. And there's rules around that. There's so many things that we have to do to make sure that organizations don't lose their certifications, or more importantly, create vulnerabilities within the organization, that could open them up to some really bad stuff that could happen with them. So again, a lot of what we're looking for here is just to be able to, share this awareness with you. Stress the fact that a HITRUST certification, is a very valuable asset, to your organization and to your go-to-market strategy. Again, it's going to help you establish trust, gain competitive edge, expand the market opportunities, enhance your, compliance with regulation and mitigate the risk, with your data security, And then one of the, the taglines that I like to put out there is, by prioritizing your data protection, obtaining HITRUST certification, you position your organization as a trusted partner in the healthcare industry. And again, that's something that, you feel free to reuse that in your literature when talking to these U.S. Providers about, not only why do they need your process, your tools, your applications, your services, but what have you done to reinforce that? With that, I want to open the floor up to some questions out there. I know we have a few minutes left with the overall presentation, but if there's any questions out there, please use the QA model and enter anything out, enter any questions that you might have. I think Eric or Andrea, is there anything additional that you think we should cover while we're waiting for maybe some additional questions to come in?
I think we covered, especially the marketing strategy. Absolutely. Just and I talked about it very briefly on the journey slide, is the nice thing about the changes to HITRUST now is that ability to start small if that's what your need is, and then knowing that you've got those progressive steps to be able to move to that maturity level. So if you're small, it's not quite as scary. So those scare tactic slides that Sean and Eric like to use, it doesn't need to be that scary. It's something that's very achievable, especially the way that HITRUST has structured the different type of assessments now.
Okay. So we have one question. First question came in. If we are HIPAA certified and HIPAA is fading off, and would it be that we would be moving to HITRUST CSF? So I think I'm going to answer the obvious right here is HIPAA is not fading off. For I guess probably in recent years, I think the emphasis on HIPAA has kind of shifted a little bit, but it's still a baseline requirement across the board for every provider out there and most agencies. But Andrea, you want to jump into the comparison between HIPAA and
Sure. So remember, there is no such thing as HIPAA certified either. There is not a certification around you meeting HIPAA requirements. HITRUST allows you to do that because that's where your certification comes in. If you're going through a HITRUST assessment, you are meeting those requirements based on obviously the scope of your assessment. So there is not a HIPAA certification, but there absolutely is a HITRUST certification. And to Sean's point, it's not going away.
No,
absolutely not.
Another question we have, and this has come up in past in the Indian CEP events, is how affordable is HITRUST in the Indian market? And I'll one of the things that I like to put out from this perspective is there's a handful of organizations like ourselves, like Accorian, that we have specific pricing for Indian-based organizations. We understand the variance between the U.S. and Indian companies. So we do have the ability to perform readiness and validated assessments via using our Indian-based teams out of Bangor. So that will reflect directly on the pricing from your assessor, is where the assessment is being performed from. So again, and from Accorian's perspective, again, we've established and set up our ability to perform that within India to be able to show some of that cost savings. But at the end of the day, I'm not going to sugarcoat it. HITRUST is expensive. A lot of this can be, expense isn't even in the validated portion of this. It's in the remediation effort. It's in the prep work. So when we're looking at cost and stuff like that, there are different layers of cost that we have to consider. But when we're looking at overall, it really is the bigger portion of this is around cost is around getting yourself ready for it and putting in the precautionary stuff that needs to be there as opposed to just a validated assessment. And yes, we will make the video available as well as the slide deck once everything is once we're done here and we get everything wrapped up. All right, Eric, any parting words?
Oh my goodness, I've got thousands of words. I think it's if you look at the state of compliance in cyber, primarily in the U.S., HIPAA is going to continue to expand. We continue to see with HICCUP, for example, or HICP as some people call it, there's going to continue to increase in standards. One of the biggest efforts that HITRUST is making behind the scenes with the government side especially is reciprocity, because every state is moving towards some type of cyber requirements, additional standards, but we are behind the scenes working for reciprocity for HITRUST certified organizations, and so we'll continue to work with our assessor organizations like Accorian, but that will give you foundational work to be able to show compliance against many of the different up and coming authoritative sources.
All right, thank you. All right, so I want to thank Eric and Andrea for attending today and providing us with this great information. Hopefully, it resonates with you and it opened up your eyes to some of the areas that that you need to concentrate on with HITRUST. We hope that some of this information also will help you bolster your marketing campaign and your ability to secure additional work with U.S. healthcare organizations by having HITRUST. So again, our information's here. We would love to talk to you if you have any additional questions about the content that we covered today, or specifically talk about your organization and what you might need to do to get HITRUST certified. So again, we want to thank everybody for attending, and we look forward to seeing you guys in future webinars. So enjoy the day. Yes, sir.
Sean, there was one question that popped in. I didn't know if you wanted to answer it real quick.
We can touch it before we end here.
Okay. Do you want to handle that or you want me to?
You can handle it since you didn't get the answer.
Okay. All right. It's a really good question. The question is, if you're going for HITRUST for the first time, what would be your recommendation? Should we go for E1 or I1 first and then move towards R2? And I would say it depends, as always. But if you're new to HITRUST, it makes and depending on the scope of the environment you're looking to get certified, then certainly the easiest path is to start with the E1, get your feet wet, mature your program, then migrate. Some organizations may be able to go straight from E1 to R2, or some may be able to start with I1. Depends on the maturity of your program you already have in place.
And additionally to that, Eric, we've seen from our perspective, it really depends on your contract obligations as well. So if you do have a provider that says, you have to be HITRUST certified in 12 months, and they're specifically calling out an R2, then obviously we have to go work on the R2, and skip the E1 and I1 approach. But again, talk with your assessor, talk with us. We'll be able to help you navigate that and build a roadmap that helps you get through this entire process where it makes sense. Okay. All right. So we are up against time. Any additional questions we will answer, via email, and we'll put out the videos and slide decks once everything is completed. So again, I want to thank everybody today for attending, and we want to wish you a great day.
Thanks, everyone.